Hello, everyone. Welcome back. It's Sasul here again with a dear friend, Chelsey. She's here going to talk about her amazing new book, her debut memoir, Healed Enough. It's a journey through complex trauma and dissociation. And she weaves her professional understanding of this complex issue as well as her own personal journey. Not only that, she's a mom, she's a wife, and an avid reader herself. And she's a licensed clinical social worker and advanced training in trauma therapy. And we're going to talk about the journey because we worked together on publishing this book. We published it happily on Mandala Tree Press. And we're so glad that you're here. Welcome, Chelsey.
Thank you for having me.
Yeah. You know, what's been really interesting about this experience is watching you kind of weave together your personal life, like really vulnerably on the page. And a lot of people probably listening who've thought about writing a memoir, but they're kind of wondering how you did this. So let's start from the beginning. When you first decided, I think I might write this as a book.
So I struggled going back and forth with, do I have enough life experience, enough material, enough things that have happened that people would want to even read about my journey. And as the years have gone on and as experiences really have quadrupled in my life, many positive, many difficult, people are like, you should write this down. And I've always, like you said, I've been an avid reader my entire life. I love writing. I love reading. I was the college kid who loved writing 30-page papers. I really love everything about reading and writing. And I've always had a dream to write a book. And when my life started to play out the way it did, I kind of merged my love for reading and writing, my desire to write a book, and then my lived experiences and put it into a memoir, along with my personal journey.
Right. So your book really starts out with your youth about how you got here, how the complexity of your life really caused this need for healing that Healed Enough is talking about in a very small glimpse for people who don't understand what complex trauma might be or how that is defined. Maybe give us from your own perspective as both clinical and personal, what that means so we can kind of know what we're talking about.
Yeah, so complex trauma differs from single event PTSD. So there are millions of people who've experienced a single event trauma, meaning there was a beginning to it, an end to it, and you can kind of put it into a neat box. Not saying the experience itself was welcoming or could be put into a box in how it feels, but from a clinical lens, there is a box around that experience. When we're looking at complex PTSD, we're looking at typically developmental trauma or multiple traumas over key developmental years that took place, where things are continued, persistent, they're often interpersonal in nature. And I think that's the really big key. So someone could have PTSD from a horrific car accident or another type of accident where a loved one may even have been lost. They almost lost their life, but it wasn't a personal attack on them. And that's one of the key differences about complex trauma. It really is an interpersonal wound and injury that takes place and is all often repetitive.
Right. So from my understanding, this is actually an area where a lot of people, including practitioners, clinicians, doctors, psychiatrists, don't have as much training about it as maybe they possibly could, and that things can get misdiagnosed, or that things can really be hard to get support or services for somebody who's experienced some of this complex trauma. Talk about that in a little bit, and then we're going to dive into where your memoir kind of weaves into the story of your personal work as well.
So complex PTSD is a diagnosis that is not a diagnosis in the DSM, which is really unfortunate. And I put it in quotations because they won't really allow us to say that is an official diagnosis. The DSM, the Diagnostic Manual for Mental Health Professionals, includes PTSD, acute stress disorder, dissociative disorders, anxiety, and depression, very common aftermath symptoms related to chronic trauma, but it doesn't have a diagnosis that wraps all those things into one. And mental health professionals have been fighting for that for so long. So I think the basis of the DSM not having or accepting that diagnosis is partially what makes it difficult for professional individuals to acknowledge, because they can't put it on paper to bill insurance. So there's some controversy there, and really unfortunate, because there are key differences in the way that individuals with simple PTSD and complex PTSD present and experience the world. And complex PTSD really means to me, or really includes all the nuances of what it's like to live with chronic trauma, even after the chronic trauma has ended,
Right.
or is no longer
And
active in your life.
so, because some of the results of this complex trauma can be other behavior symptoms that do have diagnoses.
Yeah.
People often get labeled with those diagnoses. Tell me a little bit more about that and how that does play out in this sort of scenario.
Yeah, so say someone with a long history of childhood physical and sexual abuse may not be being abused currently in their adult life, but they present with debilitating depression. So the only thing that a psychiatrist or a mental health professional may be treating them for is depressive symptoms in adulthood, with virtually no tie-in to what happened to them in childhood. So that's where there's a lot of diagnoses that are incorrect or don't include everything that should be included in their mental health profile. So yes, they may struggle with depressive symptoms, but are we looking at depression as an unhealed representation of unhealed trauma, or are we looking at it from a neurochemical standpoint? A lot of the time, both can be true, but only one is being treated. And same with substance use. We look at substance use or those type of maladaptive behaviors as behaviors that need to be stopped and fixed, and you just need to stay sober, right? And your life will get better. Well, sometimes it's really impossible to stay sober from alcohol use when your internal pain is so great, and that internal pain is not being treated from a trauma history lens.
Right. So let's then forward towards the book. So writing about something so personal, about these complex events that happen in one's life, writing it as a memoir versus writing it as maybe a book for clinicians, what was the choice making that you had to go through to decide how you wanted to tell your story versus just being maybe the expert on the page?
So I do want to become the expert on the page in my next book. However, as I was planning out this book, using the bubble sheet exercise and different things that I learned in your book course, including all of it it felt like it was going to dilute personal experiences and lived experiences, and also dilute some of the professional aspects of what I do, and both are equally as important in my work. And I wanted to really give thanks and attention to both sides of what complex trauma and dissociation means to me on a personal and professional level. So while there are professional aspects of my book, it really is a lived experience perspective of surviving complex trauma and living with dissociation.
Right. So let's move to that. So those of you out there listening who might think about, I want to write about my life, but you're not sure how to do it without, quote, hurting others, or maybe feeling like putting yourself out there is difficult. How did you address those issues for yourself, Chelsey? Like, how did you decide I'm going to include this and not that? Or maybe you just didn't have that lens at all?
Yeah, so I that lens was there briefly for me, but it also really didn't take over my writing process at all because I have 15 years of intensive work that I've done on myself that has allowed me really to have a felt sense of my agency back, of what rights I have as a survivor to share my personal experience, and what issues I've had to wrestle with over the last 15 years as pertinent to my life story. And throughout healing, especially things that happened in childhood or nuclear family patterns, I had to learn that harm can be caused, but it also doesn't mean the person was trying to cause you harm, right? And that sometimes, and this is not for all people, I do not believe all people in my story did the best they could. I don't believe abusers that I had in childhood and in adulthood did the best they can. But I do believe that for my parents, for example, in my personal journey, both of them came from homes with generational trauma in them, whether it was physical, emotional, alcohol and mental health related, right? They entered parenting with wounded lenses on and dysregulated nervous systems. And I had to acknowledge that there was harm caused to me because of that unhealed stuff that they carry, but they still did the best they could. And those two
Right.
things can live side by side. But
Right.
again, that's not everyone's experience, but for my experience, that really did help me kind of push past some hesitations I had, sharing certain childhood experiences where the people involved in those are still alive.
Right.
There are
What
people in
books
my
or
story who are no longer alive, which made things, frankly, a lot easier.
right. What books did you draw from as inspiration or help guide you on how to do this? Because memoir doesn't have a specific way it has to be. The only thing I tell authors when they're trying to write memoir is to stay vulnerable to the point of uncomfortability. And when you feel that way, it's
Yeah.
probably the right moment. Where did you draw from, like, your sense of inspiration as far as how you wanted to write this?
So I listen to a ton of memoirs on Audible. They're the only type of book I can listen to. And I think that's because the voices used in memoir are so important, because it is sharing such vulnerable personal experiences in comparison to a novel that obviously takes so much personal effort, right? I don't want to take that away, but the voice is telling a story often, which may be influenced by things in their external world. But a memoir is sharing, or was for me, sharing my internal world. And it was really important. It felt really vital that I do that with vulnerability in a way that centered what was important about my story rather than how other people would perceive it.
Right. Since sharing your story, I know it's just launched, and as we're recording this, you're getting ready to go and do some of the audio work yourself. What has been the response? Has it surprised you? Have you felt any sense of either excitement or regret? I don't know what it is, the feeling you have, but tell me a little bit about what it's like to
Yeah.
put your story out there.
I haven't experienced any regret, which I'm really thankful for. I have experienced some anxiety where I'm like, oh boy, okay. Everyone who knows me personally, professionally, in passing, and then complete strangers are going to gain a look into my internal world, especially during years of deep, deep pain. That's vulnerable. However, I also know so many people out there relate. In no world do I think I'm unique in what I've experienced. And it was important for me during my healing to have voices that helped me feel seen and understood on a deep level outside of surface crap that I could get from any self-help meme or book. And I'm not saying those don't have their place, but some of those feel very surface to me and not speaking from the heart, right? Very to-do list type mechanical suggestions and feedback. My book
Right.
is raw and vulnerable and honest, and I know has made people probably squirm a little bit, including my mother. But she got through it, and I feel like if a parent can get through reading the very vulnerable aspects of their children, things that they have experienced that no parent would wish upon their child, I think it is digestible for others.
Yeah. I know because I've read it multiple times. It's challenging to be on this side and know that someone experienced that, and yet there are aspects, even if you're not someone with complex trauma, that you learn to relate to. I found the feelings
Yeah.
of not being seen or not being heard really relatable, like sort of being
Yeah.
invisible in a family. Or so there were themes that, even though it wasn't exactly mirroring what I experienced, I do feel like that the honesty is what really captivated me in your story.
Yeah.
Um, what was the writing process like for you? Because a lot of people, they have no idea what is it like writing a memoir. Do you sit down a little bit at a time, or, you maybe go through, how it went for you?
So the writing process flowed and then it would stop. It flowed like a roaring river and then literally slowed down to a dry well. And I would go through periods of that, not long periods, but it felt like long periods where I would panic and be like, crap, I haven't written anything in 2 weeks. This is going to fail. This is never going to become a book. I don't understand how all these random sheets of paper, multiple Word documents or notepads would ever turn into a book. And it did. Somehow it did. And I think the closer I got to seeing chapters evolve and parts of the book where I could, or like structured parts of the book, it felt more attainable to me. And then I got to a part where everything was edited and I was like, I want to change it all. It's terrible. Why would I ever write this? And I was like, no, don't go there. It's written, it's down. Professionals are spending time on this, and we're going to put it out to the world and to others who need to hear a journey of healing that hasn't stopped, right? A journey of healing that is not perfected. Because I
Right.
know that is of utmost importance, because I don't sugarcoat what a healing journey looks like with complex history and some really serious present day stressors.
Right. Even through the writing of the book, things were coming up in your
Yeah.
health challenges. You had a hospitalization, a transplant in the middle of writing this book. It was so
Yeah.
powerful. And I was like, wait, are you sure you want to keep going? You're like, oh yeah, I'm going to keep going.
Yeah.
I
I know.
was like,
I think right when I signed up for the book writing course, I had surgery for my trigeminal neuralgia, so a very awful chronic pain disorder. So that was a brain surgery right at the beginning of the writing journey. And then I had a double organ transplant surgery a few months into the writing journey. And I spent so much of my recovery time writing because it was hard to stay present enough in aspects of my life, with my life on the line and having to come to terms with that, with 2 little kids at home and a husband and a family. So I really did pour a lot of what I was experiencing into writing.
It reflects in the honesty of the memoir. So rare is it that an author leans in to the hard parts, and you really did. And it's what makes it so honest and vulnerable and helpful. And
Mm-hmm.
every author feels the way you do about, oh my gosh, I need to work on this. I was
Yeah.
just working on some chapters today with Steve, my husband, and I was like, oh, I want to start over. I want to work on it again. Um, it's normal, but it's a snapshot
Yeah.
of your life. And I think you're
Yeah.
really brave to say it doesn't have to be perfect. My story's the part that's important, not the perfection of the
Yeah.
words that could get in the way. Right.
Yeah.
So we've talked about without giving away too much of the memoir story. What are some of the things that you want to share that might help people signal this might be for them? What's in the book that might call to them if they might say, well, what is it that I might relate to this author about?
So, like I said earlier, I'm definitely not the only person who has had complex experiences on this planet. And I think what's most relatable is what it was like to be a young girl and teenage girl in such a, I don't want to say unsafe environment, because in comparison to some, I was safe with materialistic things, but feeling unsafe and vulnerable in a patriarchal society that is dominated by men um, is very difficult to navigate as a young woman with um, sexual abuse history. And learning to gain that agency back, learning to turn toward myself. And I think so many people can relate to this, whether there's sexual abuse history or not, is learning to turn toward ourselves and meeting the needs or learning the needs of ourselves despite all the external noise, and recognizing struggles in present day may be fed or influenced greatly by unhealed stuff. And I don't say these things as an excuse, but they're to gain an understanding of what makes up your emotional, physical, cognitive, and spiritual well-being. And I think everyone is worth having those aspects of themselves explored throughout any sort of healing journey. And I think that is something that can be relatable throughout the book, and how to build
Yeah.
tolerance for life experiences that take place even when things are seemingly so much better than they used to, right? I don't have like this happy ending with a bow on it. My life still has complexity to it. However, you can see throughout the book the impact of the healing journey, the impact of what it's done to better my life and keep me alive, and or allow me to live longer than I would have without it.
Yeah. It brings us to present day, though the book title Healed Enough is about this idea of there is no finish line to being healed,
Yeah.
right? But there is a point at which you can live life. That's
Yeah.
the way I interpreted it. You can live life when you're healed enough, and the healing is going to continue on, but you have to get to this place.
Yeah.
And y- you you do work now. You have an organization that helps people who are going through this. Tell us a little bit about
Mhm.
that work, because that is probably an important part of your giving back, not just this book and the memoir, to help, particularly I would say women, but anyone with complex trauma.
Yeah.
How is your organization helping people who are maybe needing this support?
Yeah. So I was in private practice therapy for a while. I'm a licensed clinical social worker in the state of Arizona. So I have my master's in social work and hundreds of additional hours in specialized training for complex presentations, trauma, and dissociative disorders. And I started out in private practice because I wanted freedom from other organizations that didn't do things necessarily in ways that I would do them when it came to mental health practices. So I went into private practice and started seeing a large caseload of individuals with very complex presentations and complex histories. Regardless of how talented, how trained of a therapist I am, I still wasn't enough as an individual to meet their needs. That was humbling. Okay. By no means do I think therapists meet needs in all areas of life, but as a therapist with so much training, so much personal experience, it did not lead me to being enough for certain clients. And from my private practice, we grew an intensive outpatient program, which includes group therapy, individual therapy, case management, and psychiatric care that is all centered around complex trauma. There are a lot of treatment centers in this country, many for substance use, many for general mental health. And rarely is there a program that truly specializes in trauma-related disorders and dissociation without an influx of other diagnoses that get mixed in with that population. So Healing Foundation Center, our organization, has one sole purpose, and that's to help individuals with complex trauma, trauma-related disorders, and dissociative disorders heal from, get to a place of healed enough where they gain agency back in their life. And our whole program is centered around that population.
Is it focused mainly since it's an outpatient, is it done online? Is it done in person? People probably when they read your book, they want to know where do they get help because they're going to see themselves or see a loved one that might need this kind of support.
Yeah, so we have a campus in Scottsdale, Arizona. That's our main business. We do offer virtual care for Arizona residents, but we are not licensed in other states. So you have to be in Arizona to receive our care. For now, coming soon, we are going to be expanding to other locations in the U.S., which I'm really looking forward to, so that very niche specialized care can be available to more individuals. But with that being said, I do have a long list of, medium length list, I should say, of colleagues who are very near and dear to this work, who I refer to, whether it's inpatient levels of care or strictly individual therapy. So there is a really wonderful community of us who have dedicated their careers to treating this population.
Yeah. Let's move on to talking about the publishing process, because you've just been through it. It's fresh in your mind. There's so many unexpected things that happen. When you see a book out there in the world, you never know of all these little things that go wrong, right, sideways, or what editing is like, or cover design. Like, tell us about what was unexpected, what was exciting, what you wish you'd known more of.
So I think what I didn't realize before is how many edits a book goes through and how many different types of edits there are, from content editing to sentence editing to line editing. There are just so many different types of editing. I know I'm butchering that, but that's your area of expertise. But it felt like, oh my gosh, again, this book needs to be looked at, because I would read it and think it's right where I want it. And then editing would come in, and while they didn't drastically make changes to the book itself, but it's all the little things that go on behind the scenes that publishing a book entails, that I was a little surprised about. But now that I'm in it, it makes complete sense, and I'm grateful for it.
Yeah. I had no idea either before I started this company how much editing. I thought you just had an editor, like they just make it better, right?
That's
they
how
just
I thought
clean
too.
it up.
Yeah.
I had no idea that there was line editor, copy editor, developmental editor, that there was a proofreader. I had no idea. And
Yeah.
it does make sense. It does make sense that they all have different types of editing that needs to make it better, from, structural down to chapter, down to paragraph, down to sentence, just like you said. It's just
Yep.
like every edit has a different role. I really love the cover. I want to talk about this a little bit, because not all authors get to have so much say in their cover. In traditionally published book, definitely not. But in this case, we really wanted this cover to represent what was inside. It's such a delicate topic, and yet we didn't want it to be anything less than you were hoping for. Tell us about what the inspiration is or was, and how are you feeling about it, and as it's being shared in the world.
So I love the cover. I've had so many compliments on the cover and the title. The title came to me, I don't know, kind of at the very beginning of writing the book. And so that felt kind of easy to me. The cover, the image, I wanted it to stand out, but not in a way that was like, oh, what the heck is this book? I wanted it to stand out in I can gravitate towards this book. It looks interesting but pleasant. And I think that's what we achieved in the cover. The flower on the front of the cover is not perfect and perky and like pointing towards the sun. There is some wilting and shadowing, which, yes, is metaphorical in ways, and I'm okay with that. It really represents to me the human experience in general, that no matter how wonderful things are in aspects of our lives, it's okay to make room for the things that aren't so wonderful and that we struggle with. And that's what the cover and the title really mean to me, and just trying to be as transparent as possible with appropriate people. I'm not saying everyone has to shout their stuff out to the world, because I don't think that's beneficial either, but to have some reasonable expectations for yourself and for humans who are struggling in so many ways that we don't know about.
Yeah. What has been the reaction from people that know you? You mentioned your mother's one of the people, clients, or like what has been their response to this book, the memoir that you're sharing?
Yeah, so I actually haven't really advertised it to clients. A few know I was writing a book, but I wanted that to be a personal decision for them if they even wanted to explore their therapist history, because there are some boundaries around that in therapy. But I have received nothing but supportive, honest reviews of the book, and the sentiment has really been how raw, honest, and vulnerable I was throughout the book, without diving into details and lengthy stories of trauma that aren't really necessary. And I know many memoirs or podcasters, writers in different formats can kind of dive into things to the depth with every little detail. And I know for me that overwhelms my nervous system, and I didn't necessarily want to do that to everyone who is reading the book, but I also want readers to get a clear understanding of the pain underneath certain experiences, because I think that's what the common thread is the pain underneath experiences. For individuals, even if the experience is different, we can relate to the bottom-up approach to, or the bottom-up sensation of how traumas impact our life.
You mentioned dissociative sort of behaviors or things. For those listening that may not totally understand what that means, can you kind of summarize in layman's terms what that is, so that they can understand what that might entail?
Yeah, so dissociation is really on a spectrum. Every single person on this planet dissociates to a degree, whether that's drifting after a long day at work, kind of going into, I wish I was like in my bed and binging on Netflix, kind of dreaming of that while like driving home or forgetting where you put something. It's really a brain that's in a state of some normal day-to-day stress, right? So you're having somewhat of a normal reaction to that. Trauma-related dissociation really is more specific and more severe on the scale because it's how our body adapts when we are forced into a survival state. So that's a lot different than being tired and daydreaming. It is the survival adaptation that trauma survivors experience as a result of what they're experiencing being too much on their mind and body, especially a developing brain. So what my book is referring to is the fragmentation that happens within the brain and the personality as a result of too much, too quick, too terrifying, too overpowering, right? So dissociation is the response to chronic stress, chronic traumatization, or single event traumas that are too horrific to process. So that's the type of dissociation I work with in my professional work is disordered dissociation, not related to day-to-day stress. And that's the type of dissociation or dissociative processes I experience as a result of my trauma.
Right. So helpful. So you talked about maybe this being not the only book you'll write. You're going to consider writing a professional book around this. Choosing to write a memoir first to kind of like tell your story and not have it so intricately involved in your professional work. What book seems to be wanting to coming next, or do you know yet?
Yeah. So I really do want to write a clinician hand guide, or just a book that can help newer clinicians and newer trauma therapists to really understand the nuances of treating complex trauma and dissociative disorders and how there isn't necessarily a foolproof blueprint on how to do it, because the way one person's system, and when I say system, mind, body, spirit, adapts to survive around something may be slightly different than the other person's, or it might be the same, but the treatment has to be personalized to the representation of their fragmentation, development of dissociative parts, and so forth. So it's learning. I want to write about learning to read in between the lines with different clients to have a completely different perspective on what we see in society as like bad behaviors or things they could control. When in reality, if someone's highly dissociative, there are so many things that the brain does automatically without the person planning it, okay? Recognizing that the survival state is innate within us, within all mammals, but that unfortunately victims of complex trauma live in that survival state, sometimes far beyond the timeline of the trauma. And that's what I want to really encapsulate for other professionals.
You mentioned you have training in this and you have peers that do. What type of support do they have typically, since maybe wanting to write this book might mean a need of a void perhaps, but like what do they have to really desire to learn this, or are they given their choice, like here's what it is, and then or are they adding this on because they have a deep care like you do, obviously,
They're typically adding it on, because they have a deep care, master's programs. I mean, everyone's different, but they provide a section on trauma-informed care rather than trauma-specialized care. So all of the meat and potatoes of treating complex trauma is done way after a master's program is completed. So it's additional training, you really have to have a personal desire to specialize in especially dissociative disorders, because it's even a niche within trauma therapy. So the personal desire has to be there. Or sometimes clinicians get a client and they're like, holy crap, I have no idea what I'm doing. Everything that I was taught from, say, an EMDR lens is not working with this patient. What do I do? And then they're typically introduced to more advanced trauma therapy models.
Right. I'm so fascinated by by the work that you're doing, as well as impressed by the memoir you wrote. So grateful that I could have a small part about this. What advice would you give any other writer out there who's thinking they want to write their personal story?
Just write, even if it's for 10 minutes at a time. That's something I got really hung up on was, well, I don't have an hour to sit down and write. I learned to bring my computer everywhere. If I was stuck in the school pickup line, I would open my laptop and write for 5 to 10 minutes and let go of what the final project will look like, because all the chicken scratch, all the random notes does eventually turn into a story. And yeah, I think that'd be my advice, and just be very patient with yourself. A paragraph at a time will add up to a book. It may take time. It may feel like it's going too slow, but it does add up into a book. And I
Right.
strongly suggest anyone who's writing a memoir to have clinical or therapy support throughout the process, because it can be difficult.
Yeah, absolutely. I mean, I almost would say it's almost imperative. I'm not a therapist, but when we're doing this work, things come up that maybe they hadn't
Yeah.
even
Mm-hmm.
anticipated, or a memory, because writing is a creative process. Its job is to reach into the subconscious. Things show up that they forgot about, or that they separated themselves from. So I think that's great advice. Sometimes I've worked with people, and during the process, they said, I'm going to get a therapist, because they realize they never had one before, and writing it brought up stuff. So I think that's wonderful advice and helpful.
Yeah.
Well, they're going to want to know more about you. And of course, Healed Enough is available anywhere you can buy books. We'll have it at a link in the show notes. Where would they go to find more about you or follow about your work that you're doing?
Yeah, so I do have my clinic website, which is healingfoundationcenter.com. That will give you a lot more information on the professional work our agency provides, and more my professional profile. And then I am slowly building a website for myself, chelseyvaleri.com. And there you can find some personal and professional information about me, links to upcoming events, and of course, the book.
That's right. Awesome. Well, it's been such a pleasure to, one, be your guide as well as the publisher, but also to help navigate through this idea of sharing the truth from within you, the one you wanted to share in your way. Thank you for being a guest here. I hope everyone has at least an understanding of their own need for understanding complex trauma, or someone in their life. If you want to understand what they could be going through, not the particular story, but what's underneath, this is an amazing book. I found it super valuable for me personally, and I hope that all of you who are reading it will get something as value as well. Thank you so much, and we appreciate
Thank you as
you
well.
being here.
Thank you. It's my pleasure.